Hi, it's Dr. Josh Wall here. I am the founder and medical director of one of Australia's fastest growing doctor-led cosmetic clinics. And I'm going to talk to you today about CO2 laser. It's one of our most popular treatments here, and it is the gold standard for skin resurfacing, anti-aging skin renewal. Now, this looks like a very complicated graph. It is. This gives you an idea of all the laser wavelength spectrum. So I'm going to show you where CO2 sits here. As you go down the lower wavelengths, these things target pigments. They're the things like the pigment removal lasers, the hair removal lasers. As we come further along here, these things target redness and capillaries. So you can see the oxyhemoglobin here. That's what causes the nice result with those types of lasers. So your 1064 Nd:YAG. And as you come further along the spectrum, we get to our more skin resurfacing and kind of skin renewal anti-aging lasers. And you can see our erbium laser here and our CO2 laser here. So that's 10,600 wavelengths. And essentially what that means is that it purely has a target in the skin of water, and I'll explain how that works. Most skin resurfacing lasers, their mechanism of action or how they work is to cause a controlled micro damage to the skin. Now you can see here, this is a zoomed in version. This is actually the skin histology, so that's how it looks under the microscope. They also do some staining for that as well. And then there's some cartoon pictorial, and you can actually see the skin close up here. So it works on a fractional technology. So what that means is it only treats a fraction of the skin at once. So you can see how there's columns that have been ablated there. So when I say ablated, what happens is the 10,600 wavelength goes into the skin. The water molecules within the skin, now your skin's made up about 60% of water. Those molecules selectively absorb that energy. They become so hot they vaporize, so they kind of smoke off and they leave these columns. What happens then is that all of this healthy tissue here will migrate in and heal that area. And you'll also get, if you can see here, there's that darker pinky bit there. That's what they call a zone of coagulation. So that is a controlled damage within the skin. And that kind of damage really intensely stimulates collagen. So that's how you get so much collagen and elastin. They're the two things that make your skin look kind of tight and healthy. That's how they get stimulated so intensely. Traditionally with CO2 lasers, we used to do what's called full field ablation. Now CO2 lasers, they've been around since 1974. That was when they were first used in dermatology and cosmetic medicine. And what they do is they take off almost the entire layer of the epidermis. Now the epidermis is the upper layer of the skin. It's the layer that you exfoliate when you do an exfoliation. It's also the layer that gets sunburned, okay? Then you've got the dermis in here. Their hair follicles will come down into here. You've got a couple of nerve sensory receptors. And then you've got the fat down here. You'll notice here, this is what's called fractional ablative resurfacing. That's what we do now. And the reason we do that is that we can treat a fraction of the skin at a time, so we can go a little bit deeper, a little bit more intense. But we don't have the same downtime because you've got healthy skin cells here that can migrate in and heal there. That is how fractional ablative laser works. So the benefits is that it has far less downtime. You can actually go deeper into the skin there, and it causes more of a tightening and contraction. So the downtime for this is significantly less than the full field ablation. This is a real close-up look of the column that's been made by the laser beam. So we call these micro-treatment thermal zones. So you get a center area of ablation where that skin's basically been ablated away. And then you've got this, see this real purpley bit here? That is the zone of coagulation. So that's where you get a really intensive dermal remodeling and a collagen stimulation. And that's really great for things like wrinkling, sagging of the skin, and scar revision, because scars can be really kind of densely packed scar tissue. And the CO2 is really great for punching a hole in that, if you like, in a very controlled way to remodel and get collagen to kind of stimulate and make the aesthetic appearance of those scars look better. Then what happens afterwards is you get this healing process that happens. So as we've already discussed, you've got immediately after. So you can see those little areas of ablation there. You can see the surrounding zones of coagulation that cause a really intense collagen stimulation. And you'll also notice as well that there's a bit of a random activity. So some a little bit deeper than others, which is by design. The way the laser energy is delivered will help to reduce the heat within the skin, which will reduce downtime, which makes the laser a bit safer. So in the last decade, you've had a real improvement in how that laser energy or how that CO2 laser is delivered to the skin to improve safety and tolerability and reduce discomfort. and also to reduce that oozing, weeping kind of appearance that nobody likes. After you get 2 days in, you get what's called reepithelialization. It's a really fancy medical term for the skin cells that were here all migrate in here, and you can see how they've all migrated in there. And then you can see some signs of dermal repair. So the skin is kind of calling all of its inflammatory signals to come in and to heal, and you can see how that's a little bit patchier than that was before. That's a sign that you're getting really intense collagen stimulation. As we get to about 14 days post, you can see there's no real trace of what they call necrotic debris. So some of this here, you can see that's all essentially dead skin cells that have been cooked, if you like. That's all been replaced by nice, healthy skin. And you've got the epidermis there. So you remember how we've got a hole in the dermis there, those little channels. Your skin's completely healed in now. And you can see a real beautiful, tight, intensely collagen stimulated skin. So this is the skin looked at under the microscope, okay? Epidermis up here, so top of the skin here, and the fat's right down here, and this is the dermis in here. And then you get this ongoing collagen stimulation that probably goes for about 3 to 6 months afterwards. And then what you also get, you get the skin regeneration. So it kind of comes from the outside and it pulls in. And that's why you get a really beautiful skin tightening with this treatment. So there's a handful of settings on the machine, and they look complicated, but they're actually quite simple when you get a bit of a feel for it. You've got 3 different tips that we use. Now, the tips define how wide the laser is, okay? So if we're gonna use a 120 tip, we're using that because we want a very narrow channel, and we wanna be able to deliver intense energy so we can get a real deep a zone of ablation there. Now we can go up to 2.5 millimeters deep there in the skin. And these are really good for things like saggy skin, deep wrinkles, acne scarring it's really great for, and fibrotic scars, okay? And the reason why you want this kind of deep hole here is because you want all of this to heal inwards. So you want to create a real intense micro trauma to the skin. You're not as concerned about resurfacing the top layer of the skin. Now, as we move further across, you'll get your 300 tip, and you can see it's much wider there, okay? And that allows us to do things really well, like enlarge pores. A skin texture is really great for that. So it's wide, but it's short, and then you get a real nice thermal effect there, which causes a beautiful rejuvenation of the skin. So it's not as deep, it's kind of midway. And then you get the 500 tip, and these are just for resurfacing of the skin. So it's one of the more intense ways to resurface the skin. And you can see here how you're getting more coverage of the skin as we go up. So you remember I talked about how fractional it was, so we're not treating the entire skin at once. As we become less deep, we treat more of the skin, okay? And that's great for things like skin tone, skin texture, and luminosity. The next setting we think about is the power of the treatment. Now the power pretty much, if you want to think about it simply, controls the depth of the treatment. So we've thought about how wide we want that channel to be. Now we're going to think about how deep we want it to be. So how intense we want that laser to be. So the more power, the deeper that channel is. Now we can go one step further as well, and we can think about how quick we deliver that energy. So you'll see here, we've got lower power, which leads us to be less deep. And this one's more power, so it's deeper. And then we've got a shorter pulse width. So we've got the same amount of energy, but we're going to deliver it in a shorter time frame. So all of that energy gets delivered really quickly as opposed to really slowly. And what that does is it creates a more intense pulse at once, which allows it to punch deeper down into the skin. So it's essentially how long we're cooking the skin for, if you like. And when I say it sounds like we're cooking the skin for a long time, it's only for a fraction of a millisecond. And that will dictate how wide this coagulation is here and how intensively we stimulate collagen. Now with all these things, the shorter amount of time we deliver the energy and the higher the power, the more downtime you're gonna have, the more strong that treatment's gonna be. Now I'm gonna go back to how we deliver it in a fractional way. So this is one of the other ways in which CO2 lasers really improved over the years. It was an amazing treatment when it first came out, but the big thing was it was 2 to 3 months downtime. Your skin would weep. We used to have to use like basically burns dressings on your skin because your skin would really weep. We'd take the whole layer off, and you need your skin to protect yourself from the elements. So often you would get an infection afterwards. So now what we do is we deliver it in a fractional way. We've even gone one step further now, and what we do is, instead of going like just delivering all the dots at once, what we'll do is we do this thing called controlled chaos. So we'll deliver a dot here, and then we'll immediately come over to away from that dot to allow this dot to cool down so you don't get as much trauma. Because if I deliver a dot here and a dot here, that skin here is still going to be hot when I deliver the next pulse. This allows the skin to kind of cool down before you deliver the next pulse. Now this all happens in a millisecond. You won't be able to actually see that. But on this scale, this actually really reduces your downtime, but still gives you exactly the same results. So they become a lot more clever about how they deliver the energy, and not only the downtime, but just the safety of the treatment as well. Having the skin hot for a longer amount of time just increases your risk of complications. The next thing we do is actually the scan type, and I'm going to show you this on the laser. This is our CO2 device here. We were talking on the video about the scan type. So if you want to come right in here and have a look at the scan type. So this allows us to select square, circle, triangle, or rectangle. It still delivers the same amount of spots per square centimeter, but it just is a different shape that allows me to get into closer areas. These are all of our hand pieces. Come in a very beautiful box here. This one, 120, is a very narrow beam and allows it to go penetrate really deep. That is 300. So the bigger we get, the more shallow it goes, but the more skin it covers at the same time. And we've got 500 there. You've seen those in the videos and I've explained how they work. Now, if we put our 120 on, this allows me to select a square, a circle, a triangle, or a rectangle, and it allows me to select how big that rectangle is. So the reason why we do this is that when I'm doing the scalp here, I want a really big area because it's nothing fancy. All I'm doing is trying to cover the entire skin surface, okay? But if I want to go to a smaller area, see how now I'm at 1 millimeter and I can get in these really close areas around here. So I can get right in around the nose here, I can get right in around the corner of the mouth without over damaging the other aspects of the skin. So let's go back to our square. Now, this density here, you can see, that tells me that I'm treating 2.7% of the skin at one time, okay? Because I am on the 120 depth, so I'm going to be slightly deeper than I will be with the 300 or the 500. And the more dense I am, and I will demonstrate for you. So this is 150 spots per square centimeter. So you can see there's all this surrounding areas where I haven't touched. That allows healthy skin cells to heal in. So now if I go to a 300 density, see how there's a difference there? The density is a lot thicker. 25 spots per square centimeter. Now you can see that for an example. 25 spots, 150 spots, 300 spots. So that is density. Now this is actually the exciting part of the video. This is what it does, okay? So there's a few different real beautiful things that this laser does, better than any other laser on the planet. It is the gold standard for this kind of thing. So skin resurfacing, skin rejuvenation, there is no device better. It's universally recognized as the gold standard for resurfacing and regenerating the skin. So you can see, particularly here, things like accordion lines and some of the crepiness around the skin and just the healthy kind of glow of the skin. You can see how this is taken in light that's exactly the same, but you can see how the light is reflecting more from this skin. And what you'll find is, you know, when you look at someone, you're like, you look really healthy. What you're actually describing is how much the light is shining off their skin. When you have dull, tired skin, the light is absorbed and doesn't shine back to the other person looking at you. And you'll find this clears a lot of the irregularities and a lot of the uneven pigment in the skin as well, and allows the skin to reflect back looking far brighter and healthier. So it's a fantastic treatment for that. You can see here an even better example. All the fine lines and wrinkles around there. So that is a really beautiful result. Now there are other ways that we do this kind of thing with really intensive peels. You'll have, I mean, they're pretty uncommon. You'll only have a handful of really specialized dermatologists that do it. The results are just as good, if not slightly better, but this is a lot safer in the way it delivers energy and the downtime's significantly less. I mean, you're probably looking at about 2 weeks downtime here. The next one is acne scarring. You can see that's a real beautiful result with acne scarring there. It can actually help to shrink pores slightly as well, and also to shrink some of your sebaceous glands. You'll find an improvement in sebaceous glands with this kind of thing, which can reduce active outbreaks of acne. But you can see it's removed a lot of the redness around this. We call that post-inflammatory erythema, fancy medical term for redness that follows a trauma. And it's also, she's got a little bit of pigment that's followed that trauma as well, followed those pimples. And you can see that's significantly improved as well. So the best treatment really for acne scarring. Resurfacing, so nothing really does resurfacing better than that. You can see this is on a hand now. We would use a wider hand tip for that because we just want to resurface the top layer of the skin. We're not as interested about going deeper in this area. We just want to clear that surface pigment. Then you've got a neck. Again, really beautiful treatment for the neck. And then this is one of our favorite ones here. This is, we do this with it's called a CO2 laser facial. So the way CO2 laser energy is delivered, we can do it in multiple different intensities. So even though it's the same device, I kind of see them as different treatments altogether. So if we do a really gentle CO2 laser, you may have anywhere from kind of 2 to 4 hours downtime with that. You still get that really intense controlled micro damage, but they're really far apart and it's not as intense a power, so it doesn't go as deep. And you can get a really beautiful rejuvenation of the skin there. And that's really good for people. I mean, we're all very busy these days. We've all got often professional jobs and we don't have time for a lot of downtime. So this is a beautiful treatment. I mean, this gentleman would have had 2 to 4 hours. He could probably have, if he got it done in the morning, he could have gone out for dinner that night. It's a nice treatment for that. So you can see it's a real improvement in his skin texture and tone. So if you stuck around this long and you want to find out more, give us a call and book in your complimentary consultation with one of our experienced laser practitioners.